Hello everyone, my name is Dr. 캐리마디, or Carrie, and I am an internal medicine physician. I trained in allopathic and osteopathic institutions, and I served as a medical director and private clinician for clinics up until 2015 in Georgia. Now I live in the Dominican Republic, where I do mostly charity work and telemedicine work and occasionally see patients back in Georgia. For those of you who do not know me, this is a video that's following up from my last video in June of 2020, and that one is about the COVID-19 vaccine. And I felt the information was incredibly urgent for everyone around the world. It still is, and I'm really happy to see that many of you are sharing the information and doing your own critical thinking and doing your own research. So thank you very much. We need this. Before I begin with this next video, let me tell you that I have no connections or affiliations or interest to any company or government entity, and I am not getting paid or reimbursed in any way. This video is intended to share my thoughts with you, and it is not intended to diagnose or treat any individual. Please see your healthcare practitioner if you have any issues. So the theme of my last video was what makes us human. This one is freedom and truth. Let's start with the truth. The truth is that we are being lied to about the numbers of COVID-19 cases in the United States. There are many stories to validate this. Most recently in Florida, there were over 300 labs that were reported as having 100% of the tests come back positive. 300 labs. In reality, when they did the investigation, they found that less than 10% should have been positive. Guys, is that really a mistake? The Toronto Public Health tweeted in June of 2020 that the individuals who have died with COVID-19, but not as a result of COVID-19, are included in the case counts for COVID-19 in Toronto. We're seeing this in the US as well. The United Kingdom Health Secretary Matt Hancock told Public Health England to urgently review its daily COVID-19 methodology counts and death updates because its calculation was inaccurate. Other states and countries have incorrect counting as well. I'm just pointing out a few of the many examples you can find. Also, many people are coming forward and saying that they have been sent notices that they are positive for COVID-19 and never went and took the test. Maybe they went to a clinic and they sat in line and they just checked in, but they didn't get the test. Well, they're being counted as positive. There's many examples of this. Then in May of 2020, the president of Tanzania stated that there was something wrong with the test because he purposely tested fruit and goats with the COVID-19 test kits, and all of them came back 100% positive. And then in June of 2020, the initial test kits of the CDC were found to be contaminated with COVID-19. These are supposed to be sterile test kits. How in the world did COVID-19 get into the test kits? The CDC admits this. They didn't admit exactly how many tests and for how long this has been going on. The Center for Disease Control and the World Health Organization state that the false positive rate of an antibody test for COVID-19 can be as high as 50%. Okay, what that means is for every 2 tests, 1 test will be falsely positive. So every 2 positive tests, 1 test will be falsely positive. It's pretty high, right? Also, hospitals are getting paid more money for the diagnosis of COVID-19, also putting them on the death certificates. I would say this is a conflict of interest, wouldn't you? There are overwhelming examples of how people have had traumatic injuries, that unfortunately suicides, car wrecks, etc., but yet COVID-19 was listed as a cause of death. These are being counted as the overall numbers of deaths, overall numbers of COVID-19. Another bit of info for you to know, the hospitals may test the same person more than once for COVID-19 while they're in the hospital, sometimes up to 3 times or more. If those tests come back positive every time, they're counted as individual cases. So let's say you had 3 positive tests, that looks like 3 different individuals had COVID-19 when there's only 1. Also, really important to know, the antibody tests given can cross-react with the common cold and flu viruses. Folks, we are counting the common cold and flu viruses as COVID-19 cases. How many? I don't think there's been investigation into this. The PCR tests that they use are around 80% specificity. It sounds like that's pretty accurate, but it really isn't. So again, there's cross-reactivity with that test as well. A very important fact to know is that COVID-19 has never been isolated as an organism and proven to be an infectious agent per our protocol called Koch's postulates. I will list a link and a graph to show you a little bit more of what that is. It's a process where if we think something's infectious, it has to be isolated out of the infected organism. It has to be in its entirety, grown in a petri dish or some other medium. Once it's multiplied, take it back out, inoculate it or inject it back into a healthy organism. There has to be signs and symptoms of infection in that healthy organism. Then we have to extract the same organism out to prove that it infected that healthy organism, and then identify it as the true infection. Koch's postulates has failed the COVID-19. It's never been isolated. The Health Canada has actually printed a letter stating that there is no isolation of a COVID-19 virus. Well, maybe this could be why our testing methodology seems to be worthless. Personally, I don't trust any of it, looking at the data more and more and more as a physician and just as a person. I think we need to have proof that COVID-19 exists. I think we need an investigation into this. I think we need an investigation into the data in general. I believe the evidence is overwhelming that we are not being told the truth. The data information is bad. And we are making monumental, life-changing decisions for ourselves, our family, and our world based on false and misleading data. So what is going on? Freedom. A Kentucky couple is under house arrest right now because one of them tested positive for COVID-19. They would not sign the self-quarantine contract, and so they were treated as criminals with ankle home monitors. Broward County, Florida residents now have new laws which mandate they must wear facial masks inside their own home. Inside their own home. July 17th, 2020. Australia's New South Wales state it is restricting high-risk activities such as singing in choirs, dancing, mingling in social settings because these will spread COVID-19. In March 2020, a World Health Organization spokesperson, Dr. Michael Ryan, stated that the World Health Organization has the right to go into your home and remove and isolate family members who may be infected in a safe and dignified manner. Where would they go? A containment camp? A FEMA camp? It really sounds like propaganda used in previous wars. If I remember correctly, I think they might have called a concentration camp a containment camp or something similar to that before, right? Also, in July 2020, this month, the Health Ministry of Spain has stated it is preparing centers, get this, preparing centers to isolate asymptomatic COVID-19 patients. So, it could be me, I don't have any symptoms. Someone does a test. One of those tests that I told you could be completely falsely positive. I happen to be positive. They are planning that I would go to some center? What is that? Guys, we need to speak up. This stuff's happening around the world. I'm just giving you a few examples. Mandatory vaccines. The American Medical Association Journal of Ethics, April 2006, and I quote, "Furthermore, it is immaterial whether or not the vaccine is effective. So long as it is the belief of state authorities, the mandatory vaccine will promote common welfare and is a reasonable and proper exercise of a police power." What this is saying, they don't have to prove, they don't have to have evidence that it will work, but they can force it on you by police power. These things are happening and you don't know what's going on, okay? But we need to address it. And who are you trusting with your life? The CDC? Well, it owns over 20 vaccine patents, and it sells approximately $4.6 billion of vaccines per year. Sounds like a business to me, doesn't it? Bill Gates Foundation has donated over $155 million to the CDC, just FYI. By the way, our own president doesn't trust the CDC. It is now declared that all the labs go through the White House instead of the CDC. I mean, for better or worse, but it tells you that he doesn't trust the CDC. You trust the World Health Organization? Over $4.3 billion has been donated by the Bill Gates Foundation. Sounds like a little bit of a conflict of interest. How can they not be biased? Do you trust vaccine manufacturers? Well, the United States government shields pharmaceutical companies from liability for damages that their vaccines may inflict on a population. There are 2 mandates that were passed that give the vaccine manufacturers amnesty. One is a National Childhood Vaccine Injury Act of 1986. This gave broad legal immunity for lawsuits for vaccine injuries. Once a vaccine is approved and made available to the public, the manufacturer does not have a statutory obligation to actually collect and analyze safety and efficacy data, nor do the manufacturers, are they obligated to update vaccine formulas in light of new scientific advances. Pretty unbelievable, but that's not all. On top of that one, vaccine manufacturers have received additional liability protection under a February 2020 declaration by Alex Azar, Secretary of Health and Human Services. He states the Public Readiness and Emergency Preparedness Act gave him this authority. It grants immunity from suit and liability to all claims of loss for those who manufacture, distribute, administer, prescribe, or use vaccines. Do you understand? We have zero recourse for any harm that is done to us. What they're trying to say is that we don't have a choice. They will force a vaccine on us that has no proof that it will work. It's experimental. And then we have no recourse. So, what incentive do the vaccine manufacturers have in making sure their products are safe for us? Sounds like nothing, right? And guess who donates money to these manufacturers and researchers? You got it, the Bill Gates Foundation. Common theme. Now, we have a combination of players orchestrated by the U.S. Military Department of Defense, our military, under the program Operation Warp Speed. It's an interesting name. This is a plan to deliver millions of the proposed COVID-19 vaccine to people by January 2021. What is the rush, guys? They admittedly are cutting corners and skipping normal methods, these are their words, to validate safety because it is in the best interest of the public. What? Have you... I can't believe they're just outright saying this and getting away with it. Or perhaps it's proposed because there simply is no liability for these manufacturers. And guys, let's ask, why is our military involved? Also, the research that's coming back from this is pretty poor. First of all, it's only coming back from the manufacturers themselves. Do you trust them to tell you the truth? They're telling us what they find. We don't have independent review board looking over this that I know of. I don't know, where is it? And I would like to see a full research report. I haven't seen it. I've seen only bits and snips of them. And you know what? As doctors, we used to have full research reports where we'd have all the data and we would discuss and critique and pick apart and you know, have really some intelligent, critical conversations. How can we have it without knowing exactly all the methodology, every little detail about the subjects that are they're examining here or they're researching? Plus, I've seen really tiny numbers of people in these research studies. That doesn't mean anything. On top of it all, their justification for skipping safety measures is based on bad and inaccurate data from the number of causes I listed, talked about before. We are risking our lives, we are risking our freedoms based on wrong data. We need to wake up to the gravity of what we are facing and join together in unity and say no to forced vaccinations. And for those skeptics out there, forced vaccination to me, mandated vaccination to me, That means that it's punishing you if you don't get the vaccine. If you don't get the vaccine, they're proposing that you cannot go to school, you cannot go to outside your house to work, you cannot attend concerts, no amusement parks, no public transportation, no airports, on and on and on. Sounds like you're on house arrest. How is that freedom, and how is that not mandating a vaccine? We need to take back our freedoms and our rights. Just a little bit more information to digest. Per the CDC's websites, the number of deaths, total deaths in the US in the last 4 years were calculated between the months of January and May. In 2017, this number was 976,000. In 2018, it was a little over 1 million. 2019, it was 989,000. And in 2020, between the months of January and May, which were the peak months for the COVID-19, so the all-cause mortality was 740,000. Those numbers mean a lot to me. I hope they mean something to you. So folks, we have a lower death count than normal for the peak months of COVID-19, at least in the United States. Number two, we have an overwhelming evidence that the test data is inaccurate and misleading and grossly overreported. Number three, we also have confirmation that the virus itself, COVID-19, has never been isolated and proven to be an infectious agent. So why are we losing our rights to something in the world that is less than 1% of the population, that less than 1% of the population dies from? And why is this mandated without proof that why are the vaccines being mandated without proof that they will work? And why is it an experimental vaccine that is being pushed on us? For those of you that did not see my previous video, they're proposing using brand new technology that has never ever been used on humans before. It's modified RNA and modified DNA technology that they currently use in producing genetically modified organisms. Okay? The vector-based vaccines are also proposed using CRISPR technology, which again is, manipulating your DNA. There are some protein-based vaccines. I couldn't get a lot of information about them. I'm going to do more research, and then next week I will do another video more on the technologies of those. But you need to understand that this is experimental on humans, period. And the effects on us is unknown. The effects on our future generations is unknown. But it appears it will manipulate our DNA, because if it can do that to a tomato, an animal, why couldn't it do it to us, right? And just for those skeptics out there who tell me there's no such thing as DNA vaccines. Well, in March 2020, Bill Gates funded $5 million to Inovio to accelerate testing and scale of Selectra, a smart device for intradermal delivery of their DNA vaccine, okay? That's documented. There's others that are doing it as well. And when they use this intradermal device, they're using microneedles, which have hydrogel. And please look at my previous video for what that means. There's another article from April of 2020. They're using an electrical zap that's called electroporation. That's to get the synthetic DNA inside of your nucleus. I mean, this is proof that they are doing these things and moving forward with them, okay? Also, Sanofi is another one with recombinant DNA technology. I could go on and on. Okay, so just trying to keep this brief so that you can digest all the information I just gave you. In 1 week, I will follow up with more of the vaccine technology for you. But I hope you understand the gravity of this. So please do your own research. Be critical thinkers. And know that I'm making this video with the greatest of love and peace for all humanity in our world. We're beautiful and we're worth saving. Talk to you next time.